Speaking of the pandemic and its impact, there's only a month and a half to go before 2020 is over. Well, this time of year always flies by, as we know, and with the current increases in COVID-19 cases, how much should we try to fit into our busy schedule? So we're bringing in the expert. Dr. Jen Caudle joins us now live to discuss what we should be getting on the books. And as we know, Dr. Jen, with the rise of the COVID cases everywhere, people are wondering what's really worth it. So we're just going to run through this list and get your take, beginning with going to the doctor or going to the dentist for those appointments before a potential lockdown.
Yeah, I think going to the doctor and to the dentist are very important things to do. We want to make sure that we're not sort of missing out on our routine health care, our routine screenings that are very, very important, and also, checkups that we really, really need. Remember that your doctor's office and your dentist are doing things to help keep you and others safe. So I always say this: if you have any concerns, you're worried about going to the doctor or dentist, just call ahead and find out what they're doing to keep you safe. Remember, many doctors' offices, including my own, we're still doing some telemedicine along with seeing patients in person, but you don't want to miss out on your medical care and your dental care. Get those in, make sure that you're doing those.
What about the everyday, or I mean, for some people it's every day, but going to the grocery store, getting your groceries, a need to stock up on essentials? Do we think that we're going to see these shortages that we saw early on when the pandemic hit?
Yeah, no, I definitely remember that time. I remember when we couldn't find toilet paper, we couldn't find paper goods, couldn't find Lysol, things like this. I don't think that there's a need for panic buying. Mm-hmm. That is, we don't need to panic buy. You do not need to go to the grocery store and buy everything on the shelves and things of that nature. I think it's important to make sure you've got the essentials, but panic buying is not going to help anyone, I don't believe. And it may cause us to see shortages like we did before. So, I would say just do your routine shopping like you need to, but we want to make sure that we're putting ourselves in a safe position. Remember to wear your mask, hand sanitizer, all of those good things. So using those practices when we go to the grocery store is going to be very important.
I mean, every place that I've been, it's multiple hand sanitizer everywhere. It seems that businesses really are trying to do their part as well. So we know that a lot of jurisdictions, a lot of counties are lowering capacity at places like restaurants and places like salons, gyms, etc. So how about going to get that haircut and fitting that in?
So I think, what we decide to do outside the home really depends on a number of factors. First of all, we have to keep in mind the climate that we're living in right now. Cases are rising, not only in most or every state, but all over the country, right? We're seeing this exponential rise in cases, in hospitalizations, and even deaths as well. This is actually pretty scary. What I say is do the things that you need to do, but you need to be very careful about those. Think about your own risk level, right? Because as cases rise, it may sort of put us at further risk as we go out of the house. So think about, are you at particular risk yourself? Do you have a weakened immune system? Things like that. Think about the area that you live in particular. What actually is happening on the ground in your area? How fast are cases rising? What is the positivity rate and things of that nature? Think about who's in your household. Do you have people that are high risk in your household that if you got sick, it could really be really devastating for someone else that you live with and things like that? This is going to have to be an individual call for everyone. Again, you've got to take a lot of things into consideration to decide what actually makes sense for you to do right now and what does not.
As we see these numbers continue to go up, any concern on your behalf as someone who's in the medical profession about COVID fatigue and people, just being numb to it, because it's like every day we get new number alerts and I just feel like it's not resonating with people. They're not, when I talk to people about it, I feel like they don't know the extent and just how critical this is as far as the spikes that we're seeing. Is that a real concern for you going into the holiday?
It really, really is. And I'm glad that you brought that up. COVID fatigue is a very real thing. And we think that some of the surge in cases that we're seeing throughout the country and in individual states has to do with people getting together in small gatherings, which I think is a lot to do with COVID fatigue. I think a lot of people are tired of hunkering down. We're sort of desperate to get back to our old lives. We miss people. It's hard to be away. This COVID fatigue is dangerous, though. If we let our guard down, we will continue to see a rise in cases. And yes, also going into the holiday, I am very, very concerned about that. You know, we anticipated sort of a rise in the wintertime. People are spending more time indoors, et cetera. But with this holiday coming around, yes, there are ways to make Thanksgiving as specifically safer. And the CDC has a lot of amazing tips. But in my opinion, you know, the safest Thanksgiving you can have is a virtual one, or one with only the people in your household. Mm-hmm. Cases are rising exponentially, and we can't lose sight of that.
Mm-hmm. All right. A lot of great information this morning. Thanks for walking us all through it. Dr. Jen Caudle, have a good morning. Thanks so much.
Thank you.